Good afternoon, everyone. As mentioned, my name is Amanda Carbajal, Associate Director for Health Center Operations with the California Primary Care Association. Been with the association about 5 years now, and have the privilege of leading our oral health work on behalf of community health centers in California. All right. Oh, that's me. Hi. So for my pitch today, I was asked to talk about the expansion of FQHCs for oral health. And when I was thinking about it, I'm like, what does that mean? And to me, that's building capacities of health centers, community health centers. So federally qualified health centers, rural health centers, free clinics, all under the umbrella of what I call health centers, building their capacity to partner with you all to really expand the great work that we're doing in the community for the community that we serve. California is a great, huge, diverse state. And because of that, these efforts need to be regionally focused and come from the community. And health centers are great at doing just that. All right, so a little bit about community health centers and their impact in California. This is just a snapshot. Health centers provide high quality, comprehensive, culturally competent care to over 7 million Californians, or 1 in 5 Californians, specifically those who are in underserved areas, the uninsured, and they also are strategically located in health center or in health provider shortage areas. They are trusted within their communities. They are embedded in their community. They serve and live in their community. So they really are expert knowledge of what their community needs for healthcare. And then this slide, this data is pulled from the Health Services Administration, Resources and Administration, their annual uniform data services. And really what this shows is some specific dental data in California. And as you can see in 2022, health center dental programs, about 148 of them, provided over 2.8 million dental visits to just over 1 million patients. And let's see here. So I think, giving that overview of what health centers are, the data, their reach, their impact, what I think is really helpful is providing some specific examples. So here on this slide is just some pictures highlighting Ravenswood Family Health Network out in Palo Alto. And really this shows some of the great work that they're doing in their community. So here, this is a program that they collaborated on with their local oral health plan to provide school-based services. So they did sealants, they also did kindergarten oral health assessments. They served as referrals for children that they screened that needed additional linkages to care. They provided health education materials and other educational resources. And then another health center that I'd like to highlight for you all is Asian Health Services. I think Dr. Lay is here today. I don't know, I saw her earlier, but anyways, she's here on the picture. She said it was okay, I asked. And here is a really great program that they endeavored on with their local dental pilot program called the Healthy Teeth, Healthy Community, which was part of the Dental Transformation Initiative. And really the point of this collaboration was to increase children and youth ages 0 to 20 to receive preventative dental services. And here in these pictures, you will see part of that program was establishing what was called the Community of Practice. 5 minutes, got it, okay. So the point of the Communities of Practice was to really capacity build the dental providers within the county. So to provide them with mentoring and education, continuing education credits to build their capacity to serve more Medi-Cal beneficiaries, which they were successful in. Ultimately, they did increase the number of Medi-Cal children who receive preventative services in their county. All right. And then lastly, these are just a couple more pictures that I wanted to highlight. And I was really reflecting on some of the things that folks have said today, especially around, access, transportation, I heard was a huge problem. And how do we get folks into the clinic? And I kind of want to reframe that thought and say, how do we get services to the community? And that's what health centers are doing. So here you'll see that they have mobile dental vans that they take out to provide services in the community. Schools are huge. A lot of them leverage street medicine to serve the unhoused and to go to, health fairs, things like that. Another thing that was huge during the pandemic, but through some policy change, is remaining moving forward, which I think is great, is teledentistry. And here you can see a provider who is providing not only real-time live teledentistry services, but also asynchronous through the virtual dental home model, where you have a hygienist go out to the community, go out to the school, they take in all the information and send it back to the provider at the clinic to treatment plan. But one of the challenges, of course, when we're talking about all these really cool, innovative programs, is the workforce. And how are we going to get enough providers to do this work? And we're seeing some really great things coming out of health centers. So up here we have Shasta Community Health Center, who has a really robust dental residency training program. And then down in the other corner, that's Dientis out in Santa Cruz. And they, do we have Santa Cruz people here? Okay, woo, Santa Cruz. They are building the first dental assistant apprenticeship program at a health center, and where they're going to provide on-the-job training to upskill and recruit, train, and retain those in the community. Because we not only do we need a more robust workforce, but we need a workforce that is reflective of the community. And they're finding ways to bring down those barriers of having to go to night school, things like that, to train the next generation of oral healthcare providers. So thank you. It was a pleasure to be invited and to highlight all the amazing work that health centers are doing with their partner organizations. And again, there's just one thing that I leave you with as a key takeaway to this pitch is, we don't have to do this in silo, and we can all partner together and meet the objectives and the goals of the oral health plan. So thank you.